Hello friends, today we are going to discuss about the most important topics for the FMT for upcoming NEET and NEET PG and INICT exam. So the most important topic is the thanatology for FMT. I guess this is very important topic, and every time period is very important, and there is minimum bare minimum 8 to 9 questions directly from the FMT in your papers. Okay, so in case of thanatology, it is very important topic. So first important topic, I think this year exam is the brain stem death criteria. Please go through this topic, brain stem death criteria, and especially I will emphasize on the Harvard criteria. Please go through this criteria of I just shortly mention the criteria included: isoelectric EEG. Next is the apnea. Next is the absence of elicitable reflexes. Next is the no movement, and lastly is the unreceptivity and unresponding. So this is very important. Please go through these 5 criteria of brain stem death of Harvard criteria, and this is very important for your exam. Next is the eye changes. It is very important for this exam, and especially just remember the eye changes like cattle track. Okay, and next is the obviously the first is the eye change is the decrease in IOP. Please go through about that. It is firstly occur in within the half hour after death, and go through the remaining like tachynoia, just spotter of cattle tracking, that is the very important, that is on seen on the ophthalmoscopy. And obviously the remaining topic of thanatology, especially go through the adipose shear, and very important is the rigor mortis, like Nistan's rule in it is how it is in 12. Okay, so go through this rigor mortis. Obviously the next important is the VBCs or post-mortem staining, and I will also important on the algor mortis. Just go through the algor mortis and read about the post-mortem caloricity. It is also very important, that is the post-mortem caloricity. Okay, that is where it is seen like in case of heat stroke and in case of septicemia. This is very important. Please go through this topic, and I guess this is very scoring topic, and if you go through this you will minimum get 2 questions from this topic. Next is the very important thing like in spotter, that is the various autopsy findings. So this is like that, and there is many more confusion. If this is a nipple, so it is below the nipple, that is just below the breast, and this is the normal y-shaped incision, and it is done in case of female or to for cosmetic purposes. Okay, and next is this is the modified y-shaped, and this is done for asphyxia, especially in hanging like this. And this is one of my favorite question, I guess. This is the X incision, that is done for in case of torture cases to look for the back traumas. Okay, so this is very important, and go through this autopsy findings, and rest of the things are important, but this is the most important. Next is the mechanical injuries. In case of mechanical injuries, I will especially tell about the various findings, like in case of abrasion, the time periods for contusions, how it is changing, time periods for contusion. and I gave a mnemonics that array BBG, array BBG. So this is the array for that is the red, red के बाद आता है blue, blue after that this is brown and then green and lastly the yellow. Okay, and if it is red that is एकदम fresh है, it is fresh, it is 3 hours to 3 days, it is 4 days, it is 5 to 6 days, and it is the 7 to 10 days. And the remaining question asked is the fresh. So this is the oxyhemoglobin, this is the deoxy, blue है deoxyhemoglobin. 4 day that is the hemosiderin. Green obviously your favorite biliverdin and bilirubin. This is I guess very important. And also I will tell about the important topics like lacerated looking incision. It is seen in case of gluteus, in case of the breasts, okay, and also the incision looking lacerated wounds. Okay, lacerated wounds. This is the very important. And next is I will talk about the regional injuries, and here the most important of the various examples of injuries like that. Suppose the fissural fracture, this is the image based question mainly. Fissural fracture. Next is the gutter fracture, next is the motorcyclist fracture, and obviously this is very important, that is the pond fracture, and also there is very remaining fractures. Suppose like the remaining also are the important, but this I think this 4 is very important. Please go through these regional injuries, and this can come in your exam. And okay, I don't think the regional injuries yes, if you have time, the injuries of the various injuries in case of injury in RTA in pedestrian, the people who walking in the roads and get stuck by the cars, and also in the car peoples. Okay, in case of ballistics, I just want to tell you the most important, what is the primary bullet marking and secondary marking. And you know the secondary bullet marking is more important for diagnosis, for recognizing the bullet. Secondary bullet marking, that is the bullet fingerprinting also called as. So this is very important. Okay, so this is for the ballistics, and also the various ranges of shotgun, ranges in shotgun and rifles. This is also very important. Please go through this. What about the ranges? Because if I am going to discuss, this will be very long video, so I just skip. I think you already read this topic, so I'm just skipping these portions. Okay, next is the very important, that is the hanging. And I think this is the question, this is the area in which you can expect minimum 2 questions. And in hanging, what is the ante-mortem hanging, and post-mortem hanging difference? Okay, this is very important for your exam. And also the various findings in hanging versus strangulation. This is very important. I am highlighting this. Okay, this is very important, findings in various hanging in strangulation. Okay, you have to go through this topic by your sincerely. And also in case of drowning, the various types of drownings are very very important. Just go through this various types, and it is also important. I will especially talk about the fresh water drowning and saltwater drowning. This is all of the favorite topic of your teachers, and I think previous year in the NEET PG there is already a question came of the washerman fit. So if you have time, you can go through this topic, that is washerman fit, how when it is appears, and time periods, and it is very important. It is both senior and important postmortem, and this is also important. So go according to the previous papers questions. Next, in case of rape, I think this is the one of the bread and butter topic for your examiners, and you have to know what is about rape. Suppose in case of it is definition in 375, and especially I will especially talk about the 376 because this is very, very important. For you have to define what is 365 76A, what is AB, what is B, what is C, what is D, what is DA, what is DB, what is E. Everything everything you have to remember. This is very very important. 376 IPC, and if 375 IPC is also very very important, but more important is the various procedures. A doctor have to do in rape victim sorry friends, my iPad pencil battery has been down suddenly. Sorry friends. Okay, so rape victim examination. Okay, so this is very very important, and it is especially I want to talk about in case of 376A, and it is the especially 376A. You have to remember, if the victim goes into vegetative state or death, then it is 376A, and if it is in case of B, it is a marital rape, and I think you know. And B for I think remember AB like B like I remember like it is B for baro. That is in Bengali it talk with B for baro. So it is less than 12 years of age. If any victim rape, then it is AB. B I already told this is a marital rape. In case of C, it is the if any superior person, in case of suppose in case of a custody, or there is a superintendent or everything like that, if he undergoes a rape to the inferior people, this is considering in case of 376C. And D for obviously this is the gang rape, and D for double, that is minimum 2% is needed for criterion to fulfill the gang rape. This is 376D, and obviously remaining is 376DA, DB, and obviously DB for baro, that is less than 12 years of age of a victim and a gang rape. Okay, and E, and especially this is the if there is any repeat offense, this would be counted as 376E. Okay, so this is the very very important topics. Okay, so this is about the things, and obviously the rest important topics are various negligences. This is also very important, and this is the especially the civil negligence, civil and criminal negligence. You have to be in your heart what is the civil, and you have to remember in case of civil the patient have to prove the things, okay, and in case of criminal you have to remember the what are the various things in case of you have to remember, and what is how it is fulfilling, and this is also very important topic. And the next important topic is the toxicology, and toxicology is very image based question I have literally seen for many years, and so you have to remember the various like abrus images, abrus, dhatura. I think in previous year dhatura question has been already came, and dhatura, and obviously in case of atropine, atropine belladonna, okay, dhatura, atropine, and calotropis, oleander, strychnine. These images are very important. You have to be in your heart. You have to remember. And previous year question already bithanol already came. So this is the image based various things you have to remember. And the next important thing is the various snake bites, and you have to identify the snakes, how it is look like, various, and the difference between poisonous versus non-poisonous snake, okay, non-poisonous snake. This is also very important, and how it is scaled, and you have to remember in case of poisonous snake the scales are in the belly, it is a single scale, that is whole cover of the belly. But in case of non, suppose this is the snake, its belly, this is the full covering the bellies, okay. But in case of non-poisonous snake, there is a very small bellies, maybe scales in the belly, okay. So this is very important, the difference between. And obviously treatment, I think you have already know in your pharmacology, but treatment is also important, in which cases it is the in which cases it should be given the neostigmine, and in which cases there should be given atropine. Everything you have to remember in case of snake bite. And obviously when you snake bite, there is a very next important topic is organophosphorus poisoning, OP poisoning is also very important. So please go through this topic. And the last thing I will talk about, the very important, and I think one question you can expect in this year, that is the difference in arsenic versus lead versus mercury. So this is the very important for this year, and you have to remember what is by differencing in which, I think in arsenic you have to remember it is in aldrich Mees line. So in case of Neil is image, so arsenic. In case of mercury, you have to know it is the most common is the mercury factory, that is inhalational route, and there is a very Dunberry shakes like shaking tremors. This is you have to remember. In case of plumbism, there is a visible stippling, you have to plumbism, so you have to remember accordingly this. And I don't think any topic is left, and this is the most important various topics of this year for your upcoming NEET PG and NESET. And sorry for my sorry for this inconvenience of delaying the some part of video due to shortage of my iPad pencil charge. So thank you friends for watching this video. If you like this video, please share and subscribe the channel.